Hello and welcome to the Carpal Tunnel program. This is a comprehensive guide to beating carpal tunnel syndrome. So, just a quick background about who I am. My name is James and I'm a trainee doctor based in Nottingham, England. Now, you may have worked out from this small little logo in the corner. I'm also the founder of Fresh Reality Health. And a really quick background about what that is. I do not pretend to be an expert on carpal tunnel program. At least I wasn't. But the basis of Fresh Reality Health is that I interview people who are. I go out and I create a platform where leading experts, amazing doctors and health practitioners can come and share their knowledge and expertise and tools to help people with health problems. So I set about helping with carpal tunnel program, and therefore I curated an amazing program condensed to make very easy for people, a simple guide to follow to help them with carpal tunnel program. And for those people who helped and contributed, I am eternally grateful. Okay, so why did I choose carpal tunnel syndrome? Well, working in a hospital, I see it all the time. It is a common problem both in and out of hospital, and increasingly so for reasons we'll talk about later. More than that, it is a real problem. And what I mean is not that people are making this up in their head, but when something affects your hands, it affects you everything. It affects your life so much. And we see this an awful lot. And it's horrible to see when people are having to give up instruments or give up their jobs just because of something which is actually could be quite small. And so it is a real problem and it needs a real fix. And thirdly, it's because whilst I love being part of the health system and based in Britain, I'm part of the NHS and I love it. I really do. I'm its greatest fan. But I'm also a critic like everyone should be, and I recognise its certain shortfalls and failings dealing with certain conditions, and I believe carpal tunnel syndrome is one of them, for reasons I'll explain. So, as a trainee doctor and as a medic, we're told that evidence-based medicine is the most important. So we're told to look for the evidence in treatments and how effective they are. Unfortunately, the numbers don't lie, and the numbers show that the current treatment methods are not very good. So, as you can see here, only 23% of all carpal tunnel syndrome patients return to their previous professions following surgery. Now, I'm sure a lot of you might be glad at the idea of never going back to work, but realistically, it's your livelihood, and more often it's not just your work, it's everything else. As we said, it's your hobbies and your day-to-day life, and that is an awful figure to look at, only 23%. So, also, up to 36%, over a third of patients require unlimited treatment. That means that when first being diagnosed with carpal tunnel syndrome and beginning treatment, they will forever be receiving treatment in the ways of steroid injections or surgery. Now, in Britain, we're fortunate enough that most medical care is free, it's paid for by taxes. However, I appreciate that people all over the world who may be watching this, it is not free, and so that is something you definitely have to consider, because it breaks my heart when you see people who go bankrupt for medical bills, especially when it could be something solved so simply. So I'll talk more in a later video about the different actual treatment methods that are utilized in mainstream medicine, but just to give you a quick outline, the two most common methods are steroid injections initially, followed by surgery, known as carpal tunnel release. And basically the injections are there to try and reduce the inflammation and reduce the pain in your wrist, and the surgery, as I'll talk about later and show you, is basically there to try and cut a ligament and create more room in your wrist. But unfortunately, both of them have been shown to be, failures in most respects. And as you can see here, 50% failure rate, and that is following patients for up to 6 years, showing that 57% of them, the symptoms returned. Lastly, the 3 out of 4 people who have steroid injections go on to have surgery anyway within 1 year. So it shows how bad that is as a method of treatment. So what is carpal tunnel syndrome? Well, excuse me if I'm repeating anything that you already know. I don't mean to patronize you or anything, but I believe that understanding condition is halfway to beating it. Education really is the key. So I'll be as brief as I can, but I just want to quickly highlight what carpal tunnel syndrome is, so then we can understand why it happens, and also so you can be more informed of your decision to treat it. Okay? So it all happens because of something called the median nerve. And I'm showing you here, this small little yellow fella is the median nerve. This area right now is called the carpal tunnel. and it is housed by the carpal bones, which you can feel on the top side of your wrist and hand, but is soft on the underside, and is contained by the carpal tunnel ligament, which is the crucial player in surgery. This is what they cut in order to create more space in this area. So also contained within this area are lots of tendons and ligaments. These are simply just the connective tissues that join your bones and muscles to other bones and muscles. They're very much the cables and the mechanics of your hand. These are the bones are the structural skeletons, but the nerve is the electrical wiring. Okay, so it is the job of a nerve to carry electrical impulses from the outer peripheral limbs up and down to your brain. Okay, from your spine, your brain to the limbs. Now, most nerves will have one of two functions. It will either be sensory, and that is to be able to enable you to feel things like touch, pain, pressure, temperature. But the other is motor function, and that is simply being able to move and innervate your muscles that way. Now, the median nerve is quite unique in the fact it has two functions, and there are some other nerves that have this, but it has both sensory and motor functions, which is why it is so important that when it's damaged or inhibited in its function, it causes greater problems. Okay, so as I've shown here, you can see by the blue shaded area that this is the area innervated by the median nerve, and it branches into digitaneous and palmar branches, but you don't need to worry about that. But it innervates the palm, the thumb, the motor function in the thumb, and then sensation in large areas of the palm, the first finger, the middle finger, and the inside half of your ring finger. Likewise, on the top side of your hand, it innervates the distal areas of your first two fingers and the inside of your ring finger. And so when this nerve is impinged or inhibited, it causes three main symptoms. And these are the three main ones you have to look out for as pain, numbness, and tingling. Okay, so I tell you these not so that you can give yourself a firm diagnosis. Some of you may already know you have carpal tunnel syndrome. Some may just have some problems with your hands, and perhaps you've Googled it and trying to match up your symptoms, and that's absolutely fine. So you must understand that these can happen for a number of reasons, but I put them here so you can maybe greater understand what is going on and why. Now, there are other symptoms as well, and these are slightly more rare but equally important, and I put them there just to inclusiveness. So a dull ache and discomfort in the hand and arm, I'll talk more about this later, and a burning or prickling sensation. And this is like pins and needles, that sort of feeling you get when if you ever slept on your arm before and you wake up and it feels horrible, really. Next, we have dry skin. Now, if you normally have dry skin, then this doesn't necessarily represent anything significant. What you're looking for is changes in the skin. Likewise, if it's swelling or if there's discoloration. And something known as hyperesthesia is when you become much less sensitive. And this comes back to, again, the nerve not being able to function as it can and relay those messages to the brain. Now, as I mentioned, it controls the motor function of the thumb. So if not able to do its job, you might not be able to move your thumb as well, which is really, really annoying. It means that you can't then capitalize from the evolutionary advantage we have over all other creatures, and that is our thumb. So doing things like your buttons or playing instruments or anything that involves your thumb can be very difficult and really frustrating and tormenting, which I very much appreciate. So a way to test this is in fact to hold your palm up to the sky and then flat, and just move your thumb directly out from your palm, not up or down, but just outwards, known as abduction movement. You're using a muscle called the opponens pollicans, and it's there to test whether it is wasted away. Because when you don't use a muscle, if it's not being innervated properly, then it simply goes. So, what causes CTS? Now, this is the topic of much debate, and I'm not here to say this one thing causes it, because it is not likely one thing. Some people say it is related to repetitive strain, or at least caused by, or some people believe it is other things to do with vitamin B deficiency, and I'm happy to consider all of them. But what I want to list here, what we do know, is that it is related to professions. Okay, as you can see here, about 40% of cases are considered to be work-related. And this puts fuel onto the fire, the understanding of why it comes about, because there is a general theme. Now, I would ask you to have a look at the list, and perhaps one of them names your profession by the word, or maybe some of them are quite similar and you can relate to. But it shows that certain lifetime habits at times can cause these conditions. Now, this program won't necessarily be for everyone because carpal tunnel syndrome, as I will explain, can happen for a number of reasons, a number of conditions. But this is here for people who may have experienced carpal tunnel syndrome gradually and trying to examine why. So, we can also categorize it more into the functional reasons. So, there are three main reasons. A functional problem at the carpal tunnel. So, this is referring to a change in the structural integrity around the wrist area, normally caused by day-to-day things that are causing gradually a change in the anatomy. Now, second is a functional problem through the carpal tunnel. Now, you may get the symptoms that are like carpal tunnel syndrome not just because of an impingement of the nerve, but also because of the blood vessels that carry oxygen and nutrients to your muscles. If these are blocked or impinged, they can also cause things like numbness. So if you know that you suffer from poor circulation or heart disease, then this is something to consider. Also, unfortunately, pregnancy, thankfully it's normally only temporary just while you're pregnant, but women are normally highly more susceptible to carpal tunnel during this time. We're not quite sure why, but we think it may be to do with the swelling and the more weight bearing on the joints. But thankfully, as I said, it normally clears after pregnancy. And there are links to repetitive strain injury. And of course, there are other issues, such as diabetes. For those who don't know, diabetes is a condition whereby someone has a less ability to be able to control the levels of glucose in the blood. And when it's not managed properly, the levels of glucose, when increased, can cause damage to the nerves, cause neuropathy. And so this might be causing the nerves to degenerate, and it's nothing to do with anything else other than the diabetes. And so if you do have diabetes, unfortunately this program may not be for you, but I put it there so you can understand exactly why. And lastly is a physical problem at the carpal tunnel, and this is normally due to trauma, things like dislocations or fractures that have instantaneously altered the structure of the wrist and maybe cause scar tissue, which is causing these problems. So there is something I have to tell you about called false carpal tunnel syndrome, and this is the reason, or one of, why often in hospitals I feel it is misdiagnosed. And the reason is because the median nerve, whilst it travels in your hand and up your arm, it actually originates from the back of your neck, from the spine known as the cervical spine. And here, these yellow cables annotated beautifully by this skeleton shows the brachial plexus, the top area, then coming down the shoulder, through the elbow and through your wrist. Now, impingement anywhere along these can cause the same symptoms, which is why it's incredibly sad that if someone were to get diagnosed with carpal tunnel syndrome and then go under the knife, get the surgery, and then unsurprisingly it was not fixed because the problem was never there to begin with. So this is just something we have to consider and something I will touch on at later videos as well. And I'll also show you how you can test for it. But impingement anywhere at the neck, at the chest area, or at the collarbone can cause the same symptoms. So something to consider. So how to tell if you have carpal tunnel syndrome or thoracic outlet syndrome? So the shortfall, the unfortunate advantage of me doing this through a computer screen is I can't be there in the room with you and I can't help you in the diagnosis. So please don't take this that you shouldn't go to your doctors, because you should. They are brilliant at diagnosing these things. What I will show you is some great home techniques that you can use to help tell if you do have carpal tunnel syndrome, but these are not definitive tests, and it is better if you can go to a hospital and get what's called a conduction study where they can test the conduction of your nerves. Okay, so on to number one. The first is called tunnel sign. Now, the aim of this is to intentionally slightly provoke what could be an irritated nerve, i.e. the median nerve in this case. And the way you do this is you extend your wrist, so you palms up and then extend, bring your knuckles towards you, and what you're trying to do is expose the area where the nerve is close to the skin, moving the tendons and ligaments out the way and where there are no bones. And then with one finger or maybe two fingers or your other hand, just start by gently tapping on this area. Now you can almost just let the weight of your fingers fall on here, and the idea is to gradually increase in the hope to elicit the symptoms, or not elicit the symptoms. Now increase it enough so you can come to a conclusion. And what I mean is by this, you don't need to be hitting it and punching it really hard to know. Do it to a fair enough force, and if you're not getting the symptoms, then this is a negative. if you do begin to get the symptoms, and this is a shooting of either the numbness and the tingling or the pain in the fingers that we described, the first, the middle, and half of the ring and the thumb, then this is what's called a positive sign. Now you can combine this also with the next one called Phalen's manoeuvre. So I would say copy the picture, because it's a great picture. And the idea here is that, again, you intentionally impinge the nerve. And the way you do this is if you lift your elbows up at a right angle, put the back sides of your palms together, the top side of your hands together, pushing them gently, and then gently you can lower the elbow and you feel the 90 degrees on your wrist and a suitable impingement of the nerve. Now you don't need to do this for too long. 60 seconds is usually sufficient, or until, again, you get the symptoms. Now you can also do this another way, and that's simply reversing it, known as reverse violence. And so that is by putting your palms together like in a prayer formation. And the way you can increase or decrease the angle rather is by lifting the elbows up, which is a really good way of doing it. So, as I said before, you can get false carpal tunnel syndrome. Now, a way to differentiate between this and carpal tunnel syndrome, a simple test, is to do the one like showed in the picture. So all you need to do is hold your hands elevated above your head for a minute or until you feel the pain, the numbness and the tingling in your hands, and then lower. If it returns to normal, this suggests that there is impingement of a nerve higher up, either in your neck or your pectoralis, your chest muscle, or by your collarbone. So this is a perfect way and an opportunity to assess your day-to-day activities. What job do you do, or what do you do in your day-to-day that could be reminiscent of this? Do you stack shelves and are constantly lifting your arms up, or a painter, a decorator, a plasterer, someone who works in a warehouse constantly lifting boxes? That kind of movement can indulge muscles that cause this to happen. So thank you for joining me for part 1 in this video series, the Carpal Tunnel Cure Program. So look out for the next video, because we're going to be looking at what specifically could be causing your carpal tunnel syndrome and what you can do to make simple modifications and simple exercises to prevent further damage, help relieve the pain and reduce the symptoms, because that's what's all important. So listen, please do leave any comments or questions you might have. I'll do my best to answer them. And one of the best things about this, of course, is knowing that you're not doing it alone. And so being able to bounce ideas off one another and help each other is very, very important. Okay, so I'll see you later. Thank you very so much. Stay healthy, stay positive, and I'll see you soon. Goodbye.